Because your few little things always trigger me to think of something. So
I was treating somebody, Abby, for, well, to me, I thought it was kind of like a cyst. Well, they didn't particularly come for that kind of thing, but it was like a cyst kind of on the neck, just kind of, I suppose, down maybe at the bottom of tendon of the SCM nearly, just slightly to the right of the Ren channel.
Uh-huh.
And
the cyst is, you can see it through the skin. It's something that pops
yeah,
up.
yeah,
Okay.
yeah. Now I was doing liver aid, and I've done on 2 occasions, but it doesn't appear to be having any effect on it.
Right.
I don't know. It's hard to say. I'm not too sure if it's a cyst. It's like when you feel it, it's palpate it, it's quite hard.
Okay. So yeah. I would say, so what you do is, it's worth adding liver aid or trying. The thing is that so some of these things, I mean, is it a skin flap or is it under the skin?
It's under the skin. It's kind of like a hard lump
like
under
a bump.
the skin.
Okay.
Yeah.
And what's the location, Mary Jo?
It's just, you know, at the very, that bone in your sternum, the very top, little bit of it, I forget what it's called. Just where you have the little U shape.
Yeah.
Just on the rim, but just slightly to the right, just like if it's on the tendon there, nearly, probably the SCM tendon.
And that's not a thyroid nodule?
No.
The thyroid would be higher, I think.
Yeah, no, it's kind of just right at the bottom edge of that part of the sternum, that kind of just that top bone, manubrium, is it, or something like that.
So she, if you're not seeing, she's pointing like just to the right of Ren 22.
Yeah.
So so what happens is that, not every accumulation, obviously not every accumulation is a cyst. So what you feel a bump. So first of all, is it movable? In other words, is the bump feeling somewhat puffy? Does it have a certain amount of softness to it? So for example, because it will be different if the bump is actually on the bone, if the bump is a bony structure.
It's not a bony structure.
Okay. No. I'm just checking.
Yeah.
So
just hard, under the skin, like it feels like a hard lump.
Yeah. I'm not sure, quite honestly. I mean, you have the dogma of like, oh, if it's a cyst, but the thing is, it can be a cyst or it can be an accumulation of tissue that's not related to the liver, not related to liver aid at all. And the idea is more that when people have cysts in their constitution, then liver aid tends to be an important point for them.
Yeah. She did mention actually that it was hot, like her neck kind of felt hot.
Okay. And what's the main symptom she's coming for?
Mostly neck pain.
Oh, okay. So, gotcha. So within the neck pain, you have a liver 8 with kidney 10 or liver 8 with kidney 7 or 9 plus Sanjiao 8 for the back of the neck.
Yeah.
And you're always wanting to check the scalenes. Now it's on the other side of the tendon, it looks like, for the scalenes.
She didn't have the scalene. She didn't have
any. Didn't have scalenes. Okay.
Along there, no.
Okay. What did she have? Let's start that way.
Let me think now. She has a little bit of liver. But actually, that was something I was going to mention to you as well. Quite close to the rim channel as well. You still consider that liver?
It could be. I mean, the liver can be close to the rim channel. It could be further away. So
it crosses, right? It crosses kind of really, doesn't it? Over the liver. The liver kind of crosses really from the right side over to the left.
No. The liver itself has a certain amount that might be just past the center. I don't know anatomically if that's really true. I think the liver does. Physically, the liver does, but by the time it crosses when it's crossed over, it's totally under the ribs. It's not below the ribs, so there's no, you're not going to, I don't think you can feel, so if you're getting something that looks like across ren 15, that would be more tight diaphragm. If you're getting both sides, I mean, this is just dogmatically. In other words, they can still have liver and a tight diaphragm. But if you're getting most of it on the right side and a little bit on the left, it might be a tight diaphragm.
No, not so much on the left, but what I'm
Close to the center, but still on the right.
It's right, but it's kind of like quite close to the center as well.
That's okay. If it's quite close to the center, that still would qualify as liver.
Okay.
It's just once you're saying, once it goes to the center and to the left, I don't think one can qualify it as liver, although of course there can be somebody with a hugely enlarged liver. I mean, there's all sorts of, people don't always come according to the book. But in regular people, if it's just right-sided, chances are that it is liver, even though it's close to the center. It does not have to be nipple line only. It can be kidney line. That's okay. That's totally acceptable. So then the next thing is you check, so just to get extra confirmation for my liver 8 desires, sort of thing, I check liver 2. If liver 2 is painful, I try liver 4 and liver 8, see if that resolves my under the ribs on the right side.
Yeah.
And what does it do for the neck? What does it do for anything else, that I can find, to see just how central is this liver thing. Now, the other thing is, so we say liver 8 is the cyst point, but for some people it may not be liver 8. Maybe it's just liver in general. It's a liver phenomenon, this accumulate. So maybe I need to treat liver, which may be kidney 9 might be the right thing for treating. Has an affinity for liver. It might be liver 1. For example, someone who has right side neck pain, very clearly around C3, C4, localized, that would be more for liver 1. Or if they have bladder 43 on the right side, that tends to be a liver 1. So you can think, and you can treat the liver without treating liver points. In fact, liver excess treatment is kidney 7, spleen 7, heart 3, pericardium 4. That doesn't involve any liver points. Yeah. So you could sort of take the idea, liver shows they have they have something I consider to be possibly a cyst. Does this point be enough towards liver? Given that they have a liver finding under the ribs, it does. Now, I'm inclined to want to take liver 8 because of the cyst, so I start with that. If it proves useful, great, but if it doesn't, then okay, maybe other liver, and maybe I'll add liver 8 on top of it, but I start chasing the liver idea rather than liver 8 idea, and see what I can extrapolate or extract out of that. And then see if
yeah, I think I did 4 and 8, but I think she did have liver 2 pressure pain, actually.
Okay, so that's the other thing is some people show that, well, she showed it in the front, so you do know that she has it, but there are people who will not show it in the front, but they'll show it in the back at, at T7, T9 level, they'll show on the right side. But in her case, she's showing already on the front, so then you want to look at, rather than thinking about what solves the cyst, which may be related or not, we don't know yet, I would look at resolving the liver and resolving the neck, and then see, because sometimes, what happens is you have a cyst or you have some sort of accumulation and it's just stuck there. So it doesn't matter how much it may have come from a liver issue, but it's totally independent of it at this point. And you just have this extra tissue that's never going to dissolve. So sometimes that's why you have to surround it to try and even then it might not dissolve. But what you want to do is take all these symptoms as ideas, but don't get obsessed by them. If now the cyst becomes my main thing, it becomes, unless that's the main complaint. So the only thing you want to obsess about is the complaint they came with. If they come with neck pain and I start obsessing about their abdominal findings and I fix all the abdominal findings, but the neck pain isn't gone, or I go, oh, you have great, sorry, you know, your pulse is really weird. I want to fix your pulse. I mean, there are a lot of practitioners who do this, you know, but, you know, and 10 visits later, oh, your pulse is great. And you go, but my neck's still hurting. Who the hell cares about my pulse? They didn't come. You know, the only thing I need to obsess about is the symptom. And it really does not matter how I solve the symptom. The reason it matters to me is because you can resolve the symptom in a relatively simplistic manner, which means that on the table it looks good, but it won't take root long term because I didn't take their constitution into consideration. But if I start taking that and make that too extreme, in other words, I'm only treating your constitution and I no longer care enough about your symptom, the patient isn't going to stay because you didn't do anything for their neck. So even if I have to do something, you know, symptomatic or something that I despise, you know, and you know, oh, this stupid point for neck, you know, I hate that point. It's so primitive. It's so you know, it's not elegant. It's not whatever. It doesn't matter if it's going to get their neck.
Yeah, well, she did have an improvement in her neck because she's come, you know, so that was okay.
Then that's all. Then that's really at the end of the. So yeah, I mean, all this stuff about their constitution and their cyst and is it liver, right? This is all from me to direct me to be able to help them, not just in terms of treating the neck, but also treating the neck in the way that will the neck treatment will last the longest.
Yeah. No, she was
Sometimes
very. Yeah. She was very conscious about it, and she actually wore a scarf. It seemed to come up quite suddenly.
Yeah,
so she did mention it, you know, saying, "I have something new here that."
Right.
Okay,
so
something for.
So you might be able to dissolve it. You might be able to soften and dissolve it, or you might not. And all I'm saying is that there are cases where that will lead you to, wow, Liberate is the best point for this person. And sometimes you can go, wow, Liberate is really, you know, this person seems to be a Liberate kind of person. And you try it and it doesn't do anything. And so then you go and you say, okay, maybe not Liberate, maybe liver in general, and maybe that will do it. And then maybe it doesn't. And maybe at the end of the day, you have to say, hey, it doesn't seem to do anything. I'm going to let go. And then again, you can say what, you know, like the idea that Camille's saying, maybe thyroid, maybe parathyroid, you know, even though they should be higher, let me try that. You always just like picking up ideas and questioning them. And if the body gives you the answer, yes, I'm being influenced by the point you're just pressing, then you go, okay, cool. It may not be the full answer, but it's a partial answer. Your job is less answering the questions as much as coming up with them. Although, of course, it's important that you answer the question because that's how the treatment happens. But if I'm concentrating constantly on trying to answer the question, then I'm preventing myself from asking questions because I'm too concentrated on the one question and the answer to that question. So a little more flexibility around it is what I would suggest is useful.
And there was another point you mentioned, and I've forgotten it. It was
Okay.
for carbuncles, is it, or
for what?
Do you call it a carbuncle?
I think that we do have that term. UB63.
Oh yeah, I couldn't remember. I don't know if it is that or not. I mean, I don't know what they are exactly.
It's probably not a carbuncle because that would well, I mean, you can have internal ones that you don't see externally, but that's something that's filled with pus. That's a pus thing, carbuncles, okay. As far as I believe. I mean, that's what I think is a carbuncle as opposed to, you know, those cysts are pussy too. But I was thinking there's another point you can try, which is either gallbladder 43 or the one between the stomach channel and the gallbladder channel, like the yin spring point that will be between the stomach and the gallbladder, because you have one toe that's missing in terms of meridian. So either that one or gallbladder 43, that's another sort of cyst point.
Okay.
So you can, that's another thing that you can try rather than liver 8. That point tends to be more symptomatic than liver 8. In other words, you can shrink something, but it doesn't have as large an effect on the whole body in my experience as liver 8 does. So I would tend to use that point at the very end.
Okay. Just the end point on the toe that doesn't have.
So it's okay. So gallbladder 43 is between the fifth and the fourth toe, and the other one, the pig end point, is between the fourth and the third toe.
Okay.
Because stomach 44 is between the second and the third. So between the third and the fourth, there's no meridian.
Yeah.
Right?
Yeah.
So if you pretend there's a yin spring point on that non-meridian, that's another cyst point. Primarily for gynecology, but and as well as gallbladder 44. So both of these.
Okay. Yeah, I'll try that, Evie. Thank you.
Sure. So Camille, have we stimulated your?
Mary Jo said she had several items, so that's.
Oh, Camille.
Well, the other thing I had, Evie, was urticaria. Now I have tried the skin, the large intestine 15, kidney 9, and 216 I did.
Okay, and why? I'm just curious about the 216 because it's a wind point, or?
Yeah.
No, that's fine. I'm just curious. Okay, so obviously, and I mean, just a warning, something like urticaria is going to take a while to respond in all likelihood, because it's a pretty, it's a condition that's sort of gone beyond, it's kind of flaming sort of thing, so it's not likely to respond in 3 seconds.
Yeah, well, actually, I'm labeling it urticaria. I mean, I'm not 100. To me, I think it is like it's like a rashy looking skin. It's slightly raised.
Okay, and there's a fair amount of it. In
Yeah,
other words, it's all over.
Yeah, it's not all over actually. It's between the like upper shoulders, between the shoulder blades.
Okay.
And I think really there's a little bit kind of coming the top chest as well. So yeah.
And man or woman?
Woman.
Okay. What's the hormonal status?
Well, this woman would be early 60s, I suppose. She's
And has she had problems with her period or any sort of hormonal issues in the past?
No, not that she's mentioned.
I'm just, it's just something, especially the area of, not so much between the shoulder blades, well, between the shoulder blades, but the upper part of the shoulder blades can be hormonal possibility. You can never know, but it's just, again, it's the generating of the questions that matters, So the other thing is sometimes, on top, so that you're probably going to do kidney 9 and large intestine 15, and you'll probably do them even if they don't resolve anything, because that's your dogma for skin. So no matter what else is happening in the medical history or whatever, you'll probably end up adding large intestine 15 and kidney 9. Fair enough, no problem. By the way, liver 5 can be quite good for skin problems. Direct mox on liver 5. Okay? So you're going there regardless, and then what you want to do is think, what else can I add? One thing could be immune point. And then address whatever else this person comes with, and see what you can extract out of it. So if the kidney 9, so this is what I the way I suggest to people to operate is this. If they come with a skin problem, you will treat kidney 9 and large intestine 15. Fine, no problem. Let's say they're not coming for skin problems, but they have a history of skin problems. Now you're trying to treat kidney 9, large intestine 15 to treat their headache. That's when, that's the diversity part. I don't know if that's diversity exactly, but that's the interesting thing. So it's not, yeah, you have points that treat symptoms. Then you also have, you want to see the same points using the same thing as treating what you might call their constitution. So they're coming for skin. My question is, can I find what's a useful combination for their constitution that will also treat their skin? Given that we're talking about skin, and skin does not change that rapidly, it's, never had somebody with acne or something that on the table disappears. It just hasn't happened. Now, you have a patchy, what you can do, and if it's not too large now, you can put a bunch of press stacks around the skin thing, put tape aluminum foil on it, put the red and the green clip on the aluminum foil, and spark the foil, and have her lie down, while that's happening, and then proceed to needle, because you're not going to be checking the urticaria. It's not like you're going to check the skin. Are you less red? it's just not an option. You're going to check other reflexes that might reflect the skin, like, for example, digestive reflexes, liver reflex, those things conceivably could. Does that make sense?
Yes, it does, Evie. Yes, thank you.
All right.
Yeah, so my other thing was, I might as well just keep going now, Camille, right?
Yes, absolutely.
My pleasure, Mary Jo. Go for
it. Dryness. I'd be somebody that just complains that everything is dry, skin, hair, nails.
Yeah.
And I have done some long points, but
it's, and unfortunately, it could be many things. It can be both lung, it can be liver too, because it could be a blood, something in the blood. I don't have a great, because since it's everywhere, if you said, I have dry feet, then you can look for obstruction on the way to the feet. I have dry hands, but so, and if it's everywhere, and are we talking, sorry, I may have missed what you said. Is it just dry skin or dry other things?
Dry, yes, dry everything.
Dry,
skin,
in other words,
hair,
dry eyes, dry,
yeah,
other,
scalp, hair.
Sorry, what else?
Hair and scalp.
Okay,
everything.
okay. Hair, scalp, skin, all are a little bit in a similar category for me. Dryness of saliva, dryness of the eyes, dryness of the vagina, dryness of anything, any nose.
Well, mostly skin. Mostly skin.
Okay, so it's all back to skin.
Yeah.
So you have, obviously there okay, there are some autoimmune disorders that could cause this. It's an option. What I would, you're right, it's skin, lungs distribute fluids, but it also, by the way, the liver relates to the Wei Qi also. The way you spell liver, gan in Chinese, is a shield in the body, meaning it is an organ that's involved automatically in defense. It has like like in the Roman times, they had big shields. If you come to them with a sword, they have a shield for you, kind of thing. That's what the character for liver means. Okay. And it's also, the liver is the one that's responsible for the distribution of the nourishment and the chi, so for what they call the smooth spreading Okay, but if the skin is nourished, it suggests that the blood is not. I guess the Chinese say there's not enough surplus blood to nourish the skin and the hair. Okay. Now, could this be, so then you're getting into like, could this be a Chang issue, for example, which then moves you back to possibility of some hormonal issue? Yeah, it's possible. So you just keep playing the scenarios of what could it be, but I would definitely start with liver and lung, um, and possibly just straight out skin and immunity. So those are the things that I would start looking at. Okay, this is likely to have an effect. And then my automatic question always is, what is going on with, what's your history? What has predisposed you for this? Because the causes of, say, something like dry skin can be, let's say, could be 20,000 of them. I'm just making a number up. But let's just say there's 10. Let's say officially I could go into the Merck manual, whether the Chinese one or the Western one, and find 10, official diseases that cause dry skin. My question is always like, which one of those 10 is going to be the most likely for you, for your particular situation? So what else, what can I release here so that the blood will start, or the Wei Qi will start moving out towards the skin?
Yeah, the person didn't have a lot actually at
They could
all.
be thyroid, by the way. That's the most typical thing that one would think of is, okay, does this person have a thyroid issue?
Yeah, she didn't have a lot of reflexes.
Mhm.
Actually, back was the main lower back pain.
Okay, so you go against that. So okay, so again, what one wants to do is, you have your reflexes, in which case she doesn't have much, but she does have low back pain. So she has a reflex, she just does not have a reflex that has a name for you, that leads you to, oh, yes, she is the water metabolism number 23 kind of person. So she didn't confirm that. Fine. Okay. But I'll give you, by the way, a way to there is a test for that, but it's not acupuncture. But I'll give you a test for that. Actually, I can't, because I'll have to check it. Damn. Because I now forgot exactly. Okay, never mind. It's one of those applied kinesiology tests. So I remember the treatment, but I don't remember what you're testing. There's always a way around that. But anyway, let's go back to the acupuncture part. I lost my train of thought. Okay,
At
treatment
the
for
back, you're
Alzheimer's.
talking about
Oh,
the back.
okay, yes. So she has a reflex in the back. Let's say it's the only reflex she has is L5. Okay. Now she also has, hopefully, a medical history. If she has no medical history, you're stuck. You basically, I mean, you're not stuck, but you all you have, so let's take the case, all you have is L5 and dry skin. You have to work with just that. If at all possible, if you're lucky, there's also something in the medical history that will give you some clues as to, okay, they have cysts, since we're talking. Oh, let me try liver 8 and see what it does for L5. Let me, so you're just looking at the medical history. Sometimes it's literally grasping at straws, and the straws are not going to hold, but sometimes they're very helpful. Okay?
Yeah.
Now, let's say there is zero medical history and one finding only in the body and a symptom that it's extremely hard to test. Okay? I mean, well, let's go for the even more extreme case where you have a symptom that is extremely hard to test. So you take your dogmas to where you can take them, and you just needle, and you hopefully you can you see if you touch the skin and it's a little moister. And then the other thing is, thankfully this is not the only system out there in the world. So, TCM tells you exactly what you're supposed to do. You're supposed to nourish the blood and distribute it. So you'll do something like, say, spleen 6 and spleen 10, something like, I mean, sometimes this is what you have to go elsewhere, because within the idea of finding a reflex, you didn't find it. Or within my standard set of points, I didn't find it. Okay? Now, there is something, so what you can do, so since I do have, quote unquote, a treatment for water water that's not distributed. So the treatment itself is, well, it comes from the chiropractic world, but you can do it just with, you just take your fingers along the spine and you just press and vibrate. You do every second vertebrae on the, hopefully, you start on the even vertebrae, but no big deal. So you start at T2, T4, T6, T8, all the way down to the bottom. So what you can do is you can just have the arm up and press the arm down and ask, is this a water distribution problem? And press the, press. If the arm goes weak when you ask the question, you don't ask the question out loud necessarily. You can just ask it for yourself. If the arm goes weak, you go, okay, just press them, just vibrate all the even numbered vertebrae on both sides. If you have one of those activators, that's even better, but no, you can literally do it with your fingers. You just go, 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 go. You just press and then you ask the question again, is water metabolism, and the arm should, hopefully, is strong now. Otherwise, well, supposedly you ask the question, you got the answer, so now it's the treatment that's wrong. But that's before you ask the question like that, if you're into muscle testing, I always suggest making sure that you can muscle test them, which is something that's dependent on you and them. It's not just you and it's not just them. So you need to ask a question that you know the answer to clearly. And sometimes you want to demonstrate to them. So, let's say her name is Susan. Okay, so you say your name is Stephanie, and you push the arm, and the arm will be weak because her name is not Stephanie. It's an immediate reaction in the body. It's not like anything crazy happened. It's just natural. And this way you know. And sometimes some people, their arm will go stronger or whatever, and sometimes you recognize you just can't test. There are ways to test with leg length. You you externally rotate the foot and see where the ankles land up, and you can say this is a yes and this is a no, whichever leg is longer. That gets more complicated. The arm is relatively easy. Now the other thing is you can, and there are acupuncturists who do this. I've very, 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 very rarely done this because I'm doing this with abdominal reflexes for the most part, but on a rare occasion it has happened that I couldn't figure out an abdominal reflex or something, and I would literally ask with with muscle testing. You can't ask what should I do. It has to be a yes no answer. So you can't say tell me what to do. It's like, well, the arm isn't going to go weak or strong. You can ask, do I have in my toolkit something that I can do? And then you can say, okay, is it acupuncture? Then you can say, is it in the lung meridian? Is it, I mean, you can play with that. I mean, that's a whole other tool that it's totally legitimate as far as I'm concerned. I know that people will say, oh my gosh, that's a voodoo or something, but what we stick needles in people, how far off are we? So I would say, it's just a question of like constantly expanding one's imagination to try and find a solution. And then the other thing is also, the one thing I would say about dry skin, there's a possibility besides thyroid, something to do with the diet or the digestion. Like some people, they the way they metabolize might not allow. So, I mean, I don't know what her diet is, but you may find out, oh, well, yes, I eat lots of beef jerky and I don't like anything else. Well, they're eating lots of salt all the time and that's all they're doing. So, I mean, I'm not saying that's what's happening, but I'm just, one just never knows what the weird option might be there. But it is conceivable that there is some digestive issue that's happening. whether it's the actual food or the way it's digested. But it's a worthwhile question. I generally spend a fair amount of time just asking questions. I mean, literally asking questions, not just asking the body question, but asking the person.
Yeah.
Because I just want to, I want to see what I can find out, and I never know what they'll answer. And sometimes I ask questions that I don't know. I don't have a huge amount of trust in the question that I know exactly what I'm going to do with the answer, but I'm hoping that it would lead, the answer will suggest something else. It will prompt me to ask something else, whether the body or the actual person. So, so all I'm saying is, I would encourage you to just be a lot more open about these things, and just keep playing a much more playful attitude. Because no one has, it's not like anybody has all the answers. It's not like, we all have to ask questions. So, the more questions we ask, the better off we are. So as opposed to the other way around, it's supposed to, no, because there's this understanding of the good doctor, they see you, they know exactly. It's like, that's a myth. Or maybe it's not a myth. Maybe there are people like that, but that's not me. I don't have this capacity. The people come and, give you the wrist and say, doctor, you tell me what's wrong with me by taking my pulse. It's like, what the hell? Like, what do you think I am, a magician? And why should I tell you things that you already know? You should tell me the things that I don't know about you, not the other way around. So I can then use technique or tools to help you. I am not a fortune teller. So it's like, and I know that for a lot of people, they like the fortune telling style, but that's just not totally, it's totally not what I do. So I'm totally not embarrassed about constantly asking questions, even they seem like they're really stupid, and see what it triggers in the person. Sometimes you just ask the question to see what they'll, so in that sense, I don't ask the TCM 10 questions. But sometimes, I can see that, especially if that's one's training, it's a great way to at least have some questions for them and see what it triggers. Do you sweat a lot? It's like, well, no, but I don't like the smell of blah, blah. I mean, I don't know, whatever they'll answer. It can trigger them into to talk about other things. So it could conceivably be useful. It's just not my way of asking the questions.
Yeah. Yeah. So it's probably getting a bit just fixated on the particular problem.
We're all like that. We're all like that. And all I'm saying is, it's good to be fixated in wanting to solve the problem, because that's the job. But keep flexibility around the fact that there isn't always one clear solution, and there's not even one clear method. There's many methods. So.
Yeah, so thank you. Have a few ideas there anyway to explore.
And there's always moisturizers. So it's always, if I fail, there's plenty of cosmetic products out there that are helpful.
Yeah.
Camille, anything before we end?
Well, I just also wonder if the person's drinking enough water, because most people don't.
Right.
And also whether they're having the right fats, because saturated fats, meat fat, dairy fat, does not distribute well. And if they're not having enough of the good omega-3s, the seeds, and the oils, that can take care of a lot.
Yeah.
Yeah.
I mean, I have a couple of cases that are stubborn too, so I'm not saying that that's it, but people tend to be surprised by how much water a person should drink.
Yeah. Yes, I did. I did mention the water to her, but it's hard to know how much she actually drank.
Now,
and if they drink alcohol, or they have a lot of caffeine or sugar, you're not absorbing the water. So that's another thing. because the pancreas makes an enzyme that helps put water in the cells, and if the pancreas has to multitask with producing insulin, when people say, oh, but I drink and it goes right through me, well, then there's a problem there.
Yeah, I would agree. And also I would, well, I know this sounds very Chinese. I recommend to people to drink warm, not like tea. But and that's the other thing, is that for a lot of people, they think, well, I'm drinking coffee and tea, and they're assuming that that's the water, and that's often not the case, especially if they're, obviously if they're putting sugar in their drinks. But so can they just drink water? I drink boiled water. That's that's just me, and I don't even put lemon in it and stuff. But it gets absorbed a little bit better than when you drink. Like for example, when it's a very, very hot day. I know in Ireland it doesn't happen very often, but if it's a very hot day and you're very, very thirsty, and all you want to do is get something from the fridge and drink like a whole gallon of water, and then you're still thirsty afterwards. Whereas if you just drank a little, kind of slowly hot water, you'll actually feel a little bit more satiated, interestingly enough. But yeah, I think water, and always inquiring into the possibility of water and diet. It is really, really, really important. And people will tell you the weirdest things that don't end up to be true. Because, it's like, mostly I say to people, when I say to them, tell me about your diet. And they say, oh, I eat very well. And that's not what I asked. Tell me about what you actually eat. Okay, it's 6 o'clock in the morning. You woke up, and until the time you go to bed, assuming you don't eat at night, I want to know what you're eating, a typical day. And then suddenly from I never touch processed food, I never touch this, I never do this, I never do this. And suddenly, yes, what they meant to say is, I don't eat dinner that is just chocolate and ice cream and French fries. Okay, all mixed in one. Yeah, it's true. They don't do that. But they do all these things in smaller amounts throughout the day or whatever, And you never know what their definition of vegetables are until you actually force them to say it. And it's totally appropriate for them, for us to ask for the details.
And I've had a huge number of people who say, oh, yes, I drink lots of water. And when I question them more deeply, I find out they're drinking like 25 ounces a day or 40 ounces a day.
Yeah. So yeah, that's well, at least the ones who are doing 40, at least they are drinking. It's not, it's not too little. It's not
right,
like
and
so
you have
like
some
almost
that are
nothing.
just drinking coffee all day, right?
Yeah. So
that's true,
and there are lots of people who don't drink water. I mean, it's very common that people just never drink water. If they drink something, it's always going to be textured, adulterated. And even then they're just drinking, a lot of people drink, say, 3 cups of fluids in the day. And this is all they'll drink. Now, in fairness, we, in the last, say, 30, 40 years, there's been a very huge push for encouraging people to drink more water, and it is very useful. But just to say that I think that's partially because we can, in a more idealized world, maybe, whatever that might be, I don't know what it is, but because if you look at it, most of the food we eat is water. So it might be that we're eating more processed and more dried food. I don't know. But there is something to be said that, like we have emphasized drink more, drink more, drink more. And I'm not saying we shouldn't. I think it is helpful. Flushing. I'm looking at animals, for example. A lot of animals don't drink. A lot of animals do drink, but a lot of animals drink very little, if ever at all, because it's not available to them. Okay. Now, at the same time, those same animals, so cats, for example, don't drink much, but a very sick cat will perk up immensely. You can push water subcutaneously into a cat. So, you know, they kind of like, they look like a camel for a while, and then the water slowly kind of gets in their body. And suddenly a cat that's like almost dying looks great and acts great. So water really is important. Okay, so I'm not saying that it isn't. I'm not trying to say people shouldn't drink, but I'm just saying that there's a whole field around it that's not obvious. But the easiest, the clearest solution is definitely drink water.
Yeah.
You know, undoubtedly. You know, so it's definitely a useful thing. And yes, it's possible that for this person, she might be drinking water, or she'll start drinking water and it still isn't going to happen. That is still possible. And then you start looking at, okay, and what else is going on? What else is going on?
Yeah. Okay, thank you.
Thank you. So Camille, no questions. That's okay. We'll give you a pass, but we expect one next week.
Okay, all right. I'll try
Sorry.
my best.